We're on to learning unit number 5. We're going to be talking about accessing and paying for healthcare. And you're watching this video, and we have learning activities and student learning outcomes. You can read the topic description, but I want to talk more about how we're really going to take a strong, focused look at the community benefit obligation that all tax-exempt nonprofit hospitals have. And as part of this tax exemption that they receive, which is huge, as you're going to find out, these hospital systems need to do a community health needs assessment every 3 years. And this really forces the nonprofit hospitals to look outside their walls, engage new partners. And nurse leaders need to be aware of the health-related needs of their patients in order to assure access to and delivery of healthcare services to the most vulnerable. And we're going to complete this learning unit by developing our problem statement for each of our vulnerable population. So you're going to have different assignments, but you're going to be reading chapters 8 and 9, Compassionomics, completing a discussion board, post, no reply, and uploading your problem statement for your vulnerable population. So again, we're moving along on Compassionomics. This is, the assignment is chapters 8 and 9. I hope you're thoroughly enjoying these readings. And then there's going to be readings for this learning unit. And I needed to condense, seeing that we do have Compassionomics that's going on simultaneously, I needed to really condense what our goals and our learning outcomes are. So I'm focusing on, again, the tax-exempt nonprofit hospitals' community benefit obligation in order for them to receive tax-exempt status. So we're going to look at a couple of different things. The first thing we're going to look at is the Loan Institute. Now, if you click on About the Loan Institute, you're going to see it's a nonpartisan think tank which advocates for bold ideas for a just and caring system of health. So you can see they're not in it for any financial recuperation. They're really looking, it's a think tank, which is pretty neat. So we're going to look at the first thing that they have here, which is really an eye-opener. They published in 2023, 5 things you need to know about hospital community benefit spending. And some of it is really telling. So it starts off with what is fair share spending and what is hospital community benefits. So it starts off by explaining it to you. A nonprofit tax exemption is worth nearly $30 billion a year for the industry. So this is big. This is big for all hospitals and nonprofit hospitals. And as part of their tax-exempt status, hospitals have to offer certain financial assistance, also known as charity care, to low-income patients. And they have a form that they complete, a tax form, and you can access it online. I did. I was going to include it, but that I thought was a little too much. But now it goes on to talk about the spending that hospitals give back to the community compared to the amount of tax benefits they receive. So you can look through, and a very startling thing is that nonprofit hospitals don't give more charity care than for-profits. So you can see where they got the data from. That's number 3, number 4, and then there's 5. Benefits spending doesn't have to be connected to community health needs. So this is some really alarming information, important information as nurse leaders. So you're starting there. Then we're looking at, now this is by the American Hospital Association. Now they probably do have some benefit in making sure what they share is positive. So just keep that in mind. But they are a good source of information. And they are talking about in 2020 alone, these tax-exempt hospitals provided more than 84 billion in total benefits to their communities. So you're going to really focus on how much some of these hospital systems are giving back to the community, in what ways, and you see the drug benefit, the community benefit, charity care, financial assistance. So I'll let you look through that information. But this is important data. And sorry, we'll keep going down. And then we get into, I focused on UPMC healthcare system. So yes, I reside in Erie, Pennsylvania. UPMC is both which is headquartered in Pittsburgh, but we do have a local hospital, UPMC Hammett, but it's headquartered in Pittsburgh, UPMC. And they are both a healthcare provider and an insurer. So they also have health insurance people can opt into. UPMC operates 40 hospitals and over 700 offices, doctors' offices, and outpatient centers. So it also is mostly in the Pennsylvania area, western Pennsylvania and central Pennsylvania, but extends out into Maryland and a little bit into New York State. They also, that I was unaware of, have international hospitals. So I want you to know that I'm not picking on UPMC, but I'm going to show you some information because that was the healthcare system I was interested in knowing more about. And so when you click on here, you can change things around. These are from Loan Institute, the 2024 to 25 rankings. And you can view the rankings by hospitals with acute care hospitals, systems of care. You can go by location, so you can see, you can just put Pennsylvania in. You can select any state that you're in, hospital type or size, but then you can choose a metric. And I thought this was really important because you can choose the equity metric and either pay equity if you're interested in that, but I was looking at community benefit and I'm looking at the community investment. But maybe you can change things and look at inclusivity as well. So I want to go back to Pennsylvania, and you can do the same as you're on here. And I wanted to look at, well, we could just go for Erie, Pennsylvania, or let's just keep it at Pennsylvania. And here it shows 107 acute care hospitals in Pennsylvania ranked by community investment. Remember, so this is what we're talking, the community benefit. How much are they giving back to the community? How much is the hospital investing in the community for wellness programs, etc.? And you can see they're ranked. And if you look at Meadville Medical Center, that's one very close to Erie, Pennsylvania. I can click on that, find out the type of hospital type it is, and the social responsibility. You notice they get an A. So that's an excellent thing to see for this. I can see UPMC Lidditz. I can see other UPMC Memorial Hospitals. Remember, it's a system. Hanover. I can also continue down somewhere here, UPMC Carlisle, and find UPMC Hammett. If I click on UPMC Hammett, my local hospital, one of the local hospitals here, Allegheny Health Network 2 is a local hospital in Erie, Pennsylvania. But if I click on, I can see that social responsibility for this individual hospital got a B, not terrible score, but nationally, out of all the hospitals, here is where they sit. Out of the state, there's 77 out of 117 again, this is the community benefit, the social responsibility, the equity. So you can also look at pay equity, but we are considered a rural area. So all nurses in this area realize that compared to other areas of the state, pay is less. But you can see the community benefit. So I just want you to have that opportunity to see what is available, and as far as look up your own hospital rankings. And then to continue on with UPMC, I want to look first at UPMC's Community Health Needs Assessment. So if you click on that, this is again UPMC, the health system, their Community Health Needs Assessment. They have it really nicely done as far as where are they putting their money and their action for community benefit. Access to care, behavioral health, chronic disease prevention or management, and prevention. So you can see they make it pretty, and it looks really good, and a lot of what they're doing is very good. So let's not downplay that. But let's also look at, that was their needs assessment, and just a real quick visual of UPMC's community benefits. They're telling you how much. You can see from fiscal year 2022 is what it says to 25. It has gone up. As far as the contributions in community benefits, it tells you a little bit of where they're spending that. And it includes research and education. Charity care are big. Those are two big outcomes that they have. A lot of money is provided there, and where they're caring for the vulnerable. So they are doing good work, but then we're going to pause for a moment because I just clicked out of Blackboard. I hope you know that. So we're going to look at this other article, also by the Loan Institute. Remember the think tank. And when I picked this up, I was kind of surprised to see about an article entitled Hospitals Behaving Badly, and to note UPMC. So please do read this. As far as I know, the nurses at UPMC, they're talking about how much they're paying the CEOs, corporate jets, because UPMC, which is the University of Pittsburgh Medical Center, I should have said that, but it's a healthcare system, hospitals, over 40 hospitals, and it's an insurer. And they also have hospitals internationally. And that's where this will go a little bit more over. But it talks about the community benefit spending for, even though they're there's more money coming in as they've grown as an organization, their meaningful community investments have not grown proportionally. So I'll look at that. And there were layoffs only a couple months ago of nurses. And then it's concerning when you see what they're spending in community benefits, what they're putting out there, and paying for CEOs. So again, I'm not picking on UPMC. It was just an example that I've come across and was interested in. So that is where we're going to stop, because where is our discussion board? Here it is. I put it way up here. So the discussion board is going to be based on everything that you've looked at on the community benefit. What did you learn? Include the fair share spending. You'll see that in the first article, the 5 things you should know about the community benefit. And that really is how much hospitals receive in tax-exempt benefits, and then how much hospitals give back. That's the fair share spending. And how will it, or how does it, or how could it impact on your vulnerable population? So that is the discussion board. The last thing I wanted to go over is our vulnerable population assignment number 3. I'm going to pause one more moment because I want to make sure it opens in student view. Okay, so when I open this up, either in the assignment tab or found within Learning Unit number 5, I come to the development of a problem statement. And the first thing that you really need to do is to look at an example of what I'm asking you to do. Okay, so this is a PDF file that talks about a problem statement. And you can see the information they put in here. So I want you to first look at that. And then we're going to still have an issue here. So let me come back to it. And okay, so that was the first thing. So this is kind of your template. This is what an example so that you can complete yours. But there's also some video instructions that I put in here to help you complete this. It's at most 3 to 5 pages, and you're going to provide context based on your previous work that you've done, the first 2 assignments, and clearly define your population, what is known about the issues faced by them, and develop an issue statement. You'll see that in this example. And a vision statement and actions or objectives. And so I want you to complete that and watch this YouTube for more, because I don't want to repeat everything I said in that video. That's something I put together for you to complete. So I know it's a lot. We're moved along quickly with this course, and I hope that you're developing that expertise in your vulnerable population.